and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course,
Say
Bob.
that with a smile, Brad.
In our opinion, of course, Bob.
Okay. Today we're going to talk about, Brad, do you have fake sciatica? Piriformis versus a herniated disc.
Is that like fake news?
Just kidding. We're getting political here. Yeah, actually, if you have what is called Piriformis Syndrome, that's also called pseudo-sciatica,
okay,
which means fake sciatica.
Okay.
So there's also some other things that can cause pain down your leg. I think a lot of people get pain down their leg and they think right away, I have sciatica.
Exactly.
But there's a lot of other things that can cause it. So we're going to show you some tests to try to help you determine what you have.
And that's what the rest of this video is about. But if you're new to our channel, it's very important that if you want to subscribe, we've got a button here, or sometimes it's up here, but push that button to subscribe. For why?
Because we're going to provide videos on how to stay healthy, fit, and pain-free, and we upload every day.
Exactly.
Okay, moving on. The most common cause of sciatica, of course, is a herniated disc. Brad.
Sure.
Herniated or bulging disc. And you did a video one time where you cited a statistic that there was usually 3 million cases a year in the United States of sciatica from a herniated disc.
Right, and a small percent was from the piriformis.
Right, 200,000 was from the piriformis. So let's start off with the most likely cause, which would be true sciatica.
Sure.
So with that one, the first thing you do is the gold standard is the straight leg raise, Brad.
Sure.
Isn't it?
Yep.
So if I'm laying down, and you could almost even do this on yourself if you bring the foot up and bring it this way and it starts hurting, bringing the pain down. This is the side that has the pain on it.
Sure.
But why don't you show how you do it on somebody?
In the clinic, I'll have them put this leg down, lay in. I'll have the person relax. I usually put a pillow on their head, but for Bob, I'm not going to worry about that. And I have the person just relax, and I'll have them come up until they feel a little bit of a stretch pain. And when I get to that point, I'll dorsiflex or bring the toe in this way. And if the person says, oh, that hurts, and they say, well, the pain is just here, it feels like a muscle stretch, that would be negative. But if you go like this and they feel pain or symptoms, numbness, tingling, whatever, up past the knee, particularly up in the low back of the buttock area, that would be positive for a straight leg raise.
Yeah, and positive is not good. That means that you do have, a problem as far as probably a herniated disc or something's pinching the nerve.
Yeah, the nerve is irritated one way or another.
Let's slide the table down, Brad, and show a slump test.
We're going to have to move that wall.
Yeah, let's move the wall. All right, this is the slump test. Okay, Lonnie, you over here? All right. So with this one, it's kind of similar, actually, Brad. You slump, which is putting a little stress on the spinal cord.
Sure.
And then you bring the foot up like this.
Let me get over here.
And you bring the toe toward you.
Right.
So it's almost like the straight leg raise. It's one you could do yourself. And then while you're doing this, even bring your head down like this.
Right. One thing you want to think about is, go in that position again, Bob. If you think about the nerve, which they actually do, the nerve will come here, goes around the ankle, all the way up to the spinal cord, and then the spinal cord naturally goes up to the neck. So when you put your head down, it pulls a little bit on the nervous system so that it makes it all taut. And if there's a problem, when you put it all in that taut position, you have symptoms, pain, and
you're going to feel, again, you might feel stretching here, which is common, but when you're trying to recreate that pain going down the leg.
When you have a nerve being pulled, it's a very distinctly different feeling than pulling a muscle.
Exactly.
You'll know.
Brad, do you want to show just getting up on the toes, getting up on the heels?
This is one of those tests that
all the doctors do.
And they'll say,
real simple to do.
They'll say, get up, can you walk on your heels? And there's a good reason for this. They're checking out L5, the nerve root, working the dorsiflexors. And then they say up on your toes. And if you can do this, that's just a good sign that you have good, the nerves are sending a good signal to your muscles.
You're looking for, you might not be able to do it because it's weak, or you might not be able to do it because it's painful.
Right. A positive sign would be like this.
Yeah. You can't lift up to one side.
And it'll plop down or something of that nature.
All right. So let's say all those are fine, or even if they're not fine, you want to maybe check and see if it's your piriformis is involved.
Sure.
The piriformis is a muscle. Here's Napoleon bone apart. That's our little joke. And Napoleon's facing away from us. And there's a little muscle that runs from your sacrum, or what do people call it? Tailbone? Somewhat kind of the tailbone.
Right, that
above the
big
tailbone.
bone right there. Right,
and it attaches into your hip, the greater trochanter. So this blue represents the muscle.
Sure.
And sometimes this muscle gets tightened or even torn sometimes. And the sciatic nerve is right underneath that muscle, and it can tighten up over it and send pain down the leg.
Right. So here's the sciatic nerve, comes from the low back. It's a bundle of nerves actually, and it goes down and all the way to the toes actually. So this one little muscle can cause problems all the way down, just like a problem up in the low back.
And this nerve can actually go through the muscle too, Brad.
Right.
Some people.
Yep. Some people have what we call an anomaly.
So what I've seen a lot of people who've had this is a lot of people who sit for a living.
Sure.
And they're sitting right on that muscle, and I think they irritate it.
Right.
I had a couple accountants that had it.
This is where a lot of people say, don't wear your wallet in your back pocket.
Right.
Right.
Very good point.
Yeah, right. People like me, I got that big fat wallet, that goes in there.
Yeah, because he never spends anything out of it. That's why. All right. So the first thing you want to do is that muscle actually tender? So you can actually palpate down here, and especially if the muscle is more tender on one side than the other.
Right.
That could be a sign. Your hip is right here, and you just follow it right in there, so it should be somewhere in this range here.
Right. I always do the thing where you're like moving your leg like this, and you'll feel that bony thing moving back and forth as your greater trochanter, and you just go right in there and dig in there, and you'll feel one side to the other.
Right, and there's a difference. That's one sign that it could be piriformis. Right. Another one is that you can just do a regular stretch. You stretch the muscle. So if I lay down, I'm going to stretch this one. I'm going to bring the knee over and the hip up like this. Right. And I'm stretching it.
And you can see, this is one thing that therapists, when I was in school, to say, look at your clothing. If the clothing is being stretched, the muscle underneath it is likely to get that stretch.
Yeah, so I'm bringing it to the opposite shoulder. Now, what the telltale sign here for me, Brad, that I often see on people is that you compare the two. And they go, yeah, maybe that's a little tight. And you go like on this side, and you go, oh, that other side is tight. This one,
Or there's really painful, tender. It's like they don't want to pull it much farther.
Right. The other thing is you can actually make the muscle work once and see if that hurts.
Sure.
So one way to make it work would be to do a clamshell. Because it's an external rotator, Brad.
Yep. So the clamshell, you can't see it from that side of the video, but
let's test this one.
Yep.
So I'm going like this.
See it? Big clamshell, open and closing.
Now, if you can give a little resistance to it, Brad, and push on it, and then try it.
Right.
That's really making it work. It's also a bit of a hip abductor, Brad. So even if you do these and with a little resistance, and that hurts,
right.
That's putting the piriformis under stretch or under tightness.
And if you're at home doing these, the nice way is just do both sides, and you'll see the good leg compared to the other side. If there's a noticeable difference, it will show up if you have that piriformis.
Again, always compare one side to the other. So that's kind of the Piriformis test. Is it tender? Stretch it doesn't hurt, and if you put it under stress, does it hurt?
Right.
All right. Now we're going to the third possibility that you could be pain: spinal stenosis.
Sure.
Now in this case, you're getting pressure right on the spinal cord itself. And these are really telltale signs. I have a patient that's coming in today, Brad, that has it. I can tell him over the phone. And I go, did they tell you you have spinal stenosis? He goes, yeah, they mentioned that. And because I could tell. One thing is they have pain that goes down both legs.
Yep.
And usually to the knees.
Sure.
I don't usually see it much further than that, but it goes across their back and down both legs. It feels better when you're sitting. Much worse with walking. Their walking gets interrupted to the point they can only walk so far.
Right.
And what they call it is shopping cart syndrome. Brad, want to pull it on out?
This is not a shopping cart, but it's the same concept. If you're holding on to something and they walk and they just lean forward or go like this a little bit, makes a big difference on how it feels like. They can walk around a much further distance with this little bit of motion, a little resting on the shopping cart or their walker, as opposed to a normal upright.
And a lot of times people who have spinal stenosis cannot stand up straight.
Yeah.
They can't get all the way straight up. So that would be possibly spinal stenosis. Again, at the end of the video here, I'm going to show you how to treat sciatica, piriformis, spinal stenosis, and even the next one, which is a hip problem. If your hip can also send pain down the leg.
Sure. Yeah. So you mean at the end we have some?
Oh, I'm going to show. I'm going to have a list of videos, playlist.
So you can just click on that, go to those videos for more information.
Yeah. So if your hip problem, one thing you're going to find out is that generally, if it's coming from your hip often lacks range of motion in that size. So one thing you can do is just cross your legs. Does the one go down further than the other?
Right.
Does one stay way up? Can you go this way? Can one go much further than the other?
Right.
Can you bend one further than the other?
Right. Need a chest?
Yeah. And if they don't, that might mean that you have some pretty severe arthritis in there that's sending pain down the leg.
Right.
The last thing, Brad, is sometimes people are surprised that just regular back pain can sometimes send pain down the leg.
Right.
Not very far, usually to the knee only.
Exactly.
But just regular old arthritis can send pain down the leg.
From the SI joint, you have SI pain, that can refer down to the knee. Like Bob said, typically to the knee. If it's going down to the foot or to the toes, that's almost a certain sign of that nerve being impinged.
Right. So I hope some of those tests, kind of help you narrow it down. Obviously, you go see your doctor and get it. But I mean, you can kind of come in with armed with a little bit of knowledge, right?
Right. You can relate to them, maybe have some questions to come back with.
So watch the videos at the end here. They're going to help you out with treating these things.
Right.
So
we're getting really good at the sciatica for helping people out. A lot of comments, but we're still working on this one, Bob. Oh. Right here, this broken heart.
Yeah,
but
we can fix just about anything
Yeah.
except for a broken heart.
But we're getting at it.
Well, let's break it.
No. I want to save it for another video. I got another
All right,
idea.
Thanks.